right before it was right before it, and he was yeah, at that point he was fine. Huh?
Yeah.
I just when
We
you
don't get a Costco Busan every day.
well,
And you see?
well, so what I'm
Dr. Colfax and the team come in a minute. Just
what I just didn't was he was like coming at me,
You guys have a news release that you're
like not to.
your company
Not
has-
an issue, it's fine.
You have links to the new numbers.
So the new numbers are on the. Now I have. Now I can't even think about it. I don't take it. What are you talking about? Absolutely. No worries.
Yeah. Well, now that my ear is wearing off, it's like, I feel like that really helps me come. Yeah.
Does that work? Okay.
So have you guys been on, were you guys on Mission Street during your course?
I was in and around.
Because Mission Street is back to being a total shit show, and I don't know if that was ever cleaned up. Like from Federal Building to a block, well, like a block west of Federal Building to like Fifth Street.
Yeah.
It's a total shit show.
Yeah.
I don't know if that was a shit show during.
You're talking traffic or everything?
No, I'm talking about tenants.
Yeah. No, it's been.
Was that ever cleaned up?
I didn't see it cleaned out.
they have had more people around the federal building than since.
Well, right, but they talked about the cleaning in San Francisco for Dreamforce, but was that never part of the plan?
I don't think it was. They hit Howard Street hard from all. That's all.
Really see, okay, I think you're sitting in.
My name's Benji, you can come up.
All right,
All right.
is this on? Can you all hear me okay? All right, thank you. Good afternoon, everybody. Hello, and thank you for joining us today. I'm Grant Colfax, Director of Health for the City and County of San Francisco, and we are here again today to address the distressing fact that every day we are seeing people die on the streets of San Francisco from fentanyl overdoses. Each of these deaths is preventable. We know fentanyl is extremely potent, highly addictive, and carries a great risk of overdose. But we need to understand, we all need to understand, that recovery from addiction to fentanyl and other opioids is possible, and possible for every person. Thankfully, we live in an age where we have effective, evidence-based medication-assisted treatments available to help people overcome opioid use disorder. Methadone and buprenorphine help people recover and live a stable and productive life. No one has to do it alone. And the health department and our community partners have support systems to help people through the process and beyond. Unfortunately, according to the numbers released today by the Office of the Chief Medical Examiner, I am sad to report that 84 people died of an accidental overdose in August in San Francisco. And unfortunately, this is more than the previous month when 74 overdose deaths were reported. These are brothers, sisters, mothers, fathers, friends, partners, and members of our community. Sadly, this epidemic of overdose deaths is not limited to San Francisco. It is happening across the Bay Area, across the state, and indeed across the country. Here at the Department of Public Health, we are working to prevent overdoses and save lives through a multitude of strategies and interventions, and especially by making treatment and services, including medications for treatment, easily accessible to anyone who is ready. Later today, the Health Department is launching an informational dashboard on the sf.gov website to highlight overdose and treatment trends in San Francisco. We are doing this to increase the awareness about overdose deaths and treatment trends. We feel that it is extremely important that people have accurate, transparent information, not only about the unfortunate deaths that we're seeing, but also trends in people accessing treatment and other services. We, as a society, must end the stigma around substance use and encourage recovery in order to get people the help they need. Now, I would like to welcome Dr. Hillary Cunnins, our Director of Behavioral Health Services, who will provide more details about the dashboard. Thank you.
Thank you, Dr. Colfax. I'm Dr. Hillary Cunnins, Director of Behavioral Health and Mental Health, SF. I want to reiterate that the numbers Dr. Colfax shared are tragic. We want to convey that though addiction is a serious and life-threatening illness, it is treatable and recovery is possible. We must do everything we can to save lives. Our new overdose dashboard will launch today on sf.gov and feature the most recent available data related to substance use treatment and overdose. These data help guide the city's response to the fentanyl overdose crisis. The dashboard will be updated on a monthly basis with preliminary unintentional overdose death numbers from San Francisco's Office of the Chief Medical Examiner by month and by year. We will also be tracking the amount of naloxone, the antidote to an opioid overdose that is distributed by the San Francisco Department of Public Health and our community partners. So far this year, we have passed out more than 73,000 naloxone doses. This life-saving medication is being routinely distributed in high-risk settings where people are vulnerable to overdose, including during our street care outreach and in our outreach to encampments in the city, in the lobby of our jail, in treatment centers, and in permanent supportive housing. Our work at housing sites includes training for staff and residents and providing easy access to naloxone via communally accessible naloxone cabinets. Our goal is to provide not only overdose prevention education, but importantly about training and materials about connecting to our full continuum of services. Soon the dashboard will also include the number of overdose-related 911 calls received each week. We are also reporting the number of people accessing residential treatment and withdrawal management programs through DPH services. We have counted 417 people who have entered residential substance use treatment through DPH from January through June of this year, 2023. There are another 765 individuals who exited withdrawal management programs, often as the first step to continuing their care. We also will be tracking the number of individuals receiving medications for addiction treatment. Last year in San Francisco, approximately 2,500 people received the medication buprenorphine, and approximately 2,200 were in treatment using methadone. As you heard from Dr. Colfax, here and nationwide, the majority of overdoses are driven by fentanyl. Methadone and buprenorphine are the most effective medications to help people recover from an opioid use disorder, including fentanyl. In San Francisco, anyone who wants to start methadone or buprenorphine for an opioid use disorder can do so, often the same day. To make treatment more easily accessible, we are taking a number of steps, and I want to highlight, as we have discussed, our increasing hours of operation in our Behavioral Health Access Center, BHAC for short, which is located at 1380 Howard and now has evening and weekend hours. BHAC is the front door to our treatment systems, offering referrals, linkage to care, and other supports. We have also increased hours in our office-based induction center, where people may access buprenorphine and other treatment, our behavioral health pharmacy, and in the BART Market Street opioid treatment program, which offers methadone and buprenorphine. We have expanded to both weekend and evening hours at these sites. We want to send the message that though fentanyl addiction and other opioid use disorders are serious and potentially life-threatening, help is available. DPH has many accessible programs for people who are at risk of overdose and who use drugs, and dedicated and experienced staff who are ready to provide support to people seeking treatment. To find treatment, we encourage people to visit our findtreatment-sf.org, walk into our Behavioral Health Access Center, or call our 24/7 access line. To talk a little bit more about the effectiveness of medications for addiction treatment, I'd like to introduce you to Karen Triandiphilis, our psychiatric nurse practitioner from the Opiate Treatment Outpatient Program, also known as OTOP, at Zuckerberg San Francisco General Hospital. Welcome up, Karen. Please correct me.
Thank you, Dr. Tunners. Hi, I'm Karen Triandiphilis. I'm a psychiatric nurse practitioner who's been working at the Opiate Treatment Outpatient Program at Zuckerberg San Francisco General Hospital, also known as OTOP, or Ward 93, for the past 15 years. Annually, our clinic serves nearly 700 individuals, providing medications for opiate use disorder and a wide range of other medical and behavioral health services to promote overall good health and wellness. So far this year, we've admitted more new patients than we did in all of last year, and our total patient census is higher than it has ever been at any point over the last 10 years. We are working hard to make it easier for people to access our services same day and to be admitted, and would like to continue to expand our services. We're busier than we've ever been. Treatment with methadone and buprenorphine is the most effective tool to reduce overdose deaths among people who are addicted to opiates. I see firsthand how effective these medications are and the impact they have on the lives of individuals and their families. We see a tremendous amount of suffering, human suffering at OTOP, and are intimately aware of the costs of opiate addiction and overdose. Every day we hear patients share stories about their friends, lovers, companions experiencing overdoses and sometimes dying of overdoses. We offer naloxone in our clinic and often hear stories of our patients rescuing others in the community from overdoses. We also hear how afraid they are of dying themselves and how relieved they are to be in treatment. I've worked with people who've been extremely successful in stopping opiate use, maintaining recovery with methadone and buprenorphine, and getting their lives back on track. I've seen lives change dramatically for the better as medications give them the clarity to address other issues, like acquiring housing or re-engaging with their families and community, going back to school, or getting jobs. As effective as these medications are, unfortunately, treatment is still highly stigmatized, and that stigma is often a significant barrier to accessing treatment and recovery. The recovery community is increasingly embracing medication treatment for opiate use disorder, which has been helpful in destigmatizing it, but there's still work to be done. I just want to stress, recovery is possible for everyone. If you are using opiates like fentanyl, heroin, or opiate pills, come to OTOP or any of the other treatment programs in San Francisco, and we will help support you through your journey. It is never too late to recover from opiate addiction. Thank you.
Thank you. We'll take some questions. Any questions from our media?
Yeah, so Dr. Colfax, the numbers you gave in terms of the overdose, 84 compared to 74, is that just fentanyl, or is that just total overdose, and what is the fentanyl number as it relates to that? And then I have one follow-up.
Thanks for the question. The 84 that Dr. Colfax mentioned are preliminary overdose deaths, apologies, for the month of August. That includes all substances. About 80% represents deaths involving fentanyl.
Okay, and my follow-up question for either one of you is, so who is this news conference for? Is it for because it's like the announcement, the bottom line is there is treatment out there. I get it. So is it the view that the people who are using are reading the Chronicle and watching local news and this is gonna get word to them? Or is this message to the families of these folks who are out there? Or is it to San Francisco to let them know the public health department is doing something? I'm just not sure. Obviously you have street teams that go out to see the people in person, but who is this for?
Yeah, I think so. It's an important question. I think the key things we want people to understand is that recovery is possible. Treatment is available for a number of sites across the city, that we have evidence-based treatments, and that we are doing everything we can to prevent more overdose deaths. We have naloxone, which, as you know, reverses overdose deaths. You've heard about the amazing numbers of units that we've given out. We have methadone, we have naloxone, we have multiple medical treatments. We also wanted to make the point that later today we will be hosting a publicly available overdose prevention site, because we want people, it's hard to look at the numbers, it's hard for, it's hard for me to look at these numbers every month and see the numbers continue to go up, but we think it's important that we put the numbers out there so people can really understand the seriousness of this issue, and also include treatment availability access points on that site, as well as how many people are accessing treatment and other medication treatment and other modalities. So it is a combination of factors. I also think, candidly, there's a sense of hopelessness and despair with regard to the overdose epidemic that we're seeing, again, not only in San Francisco, but across the country. Very understandable. It is a tragedy that is unfolding every day. We had nearly 3 deaths a day in August in San Francisco due to overdoses, 80%, at least 80% of which, based on prior data, we know are due to fentanyl. We want to make sure that people not only understand that, but understand that there is hope, that recovery is possible, and as you heard from Karen, that there are practitioners across the city using evidence-based treatment to turn this around. Thank you.
Thank you.
Follow up, John. I think a lot of people have been asking for more data and more information. And now that you've released this, I'm sure people will ask for more. I have a question about the people entering treatment. Do we get to know which avenue through which those people are entering treatment, or is it just the total number? Do we get a picture of?
Yeah, I'll let Dr. Cunnins answer a few more details, and I will also say that this is our first posting of a dashboard of an issue that is so important. I just from the COVID pandemic, we saw how important and effective having dashboards up and information available is, and we expect this to be an iterative process where we continue to respond to what's needed as much as our analytic capacity allows us to. In our collaboration with other city departments will help catalyze that. So, but Dr. Cunnins has a few more details on this.
Thanks for the question. As you'll see, we are going to be sharing the numbers of people receiving methadone treatment as one visual, people receiving buprenorphine treatment as another, people entering residential treatment. One can also be receiving medication treatment while in residential treatment, so there may be some overlap in numbers. And then people exiting our withdrawal management. We are interested in showing there are multiple pathways of treatment, wanting at the same time to highlight how central medication treatment is to the effective treatment of opioid use disorder in particular. But we have many folks coming into care who might be experiencing homelessness or unstable housing, for example, and for them residential treatment may be particularly important. So we are tracking all of those aspects of treatment. As we get more experience under our belt with the dashboard, I'm sure we will be receiving feedback and adjusting how we present information as we are able.
Quick follow-up, I imagine this includes like Salvation Army and everybody else?
It will include all DPH funded or related programs for whom we collect and offer data. There are sectors of the treatment system that are entirely serving, for example, people with commercial insurance, and we unfortunately don't have access in the case of residential treatment to those data. And these are some of the nuances we do want to make clear in our dashboard and how we report the data. So if we are receiving data and they are publicly funded, we will be presenting those data.
So, so the numbers have gone up 10 since last month. So at what point, last month you announced you've expanded the hours, you've expanded the outreach, and I'm assuming that is all still in place, and so stuff takes time. So at what point, if the numbers continue to go up, then what? Then do you say, well, what we're doing is not working, or do you say we've got to do something else, or do you say we've got to throw more money at it, or because obviously 1 month to the next is not enough to say something like that, but
so as we are releasing the dashboard, we are very intent on tracking overall trends. You point out that month-to-month variation can happen regardless of whether your programs or interventions are working in any given month. It is very clear that this is a crisis, both here in San Francisco and nationally, and experts from around the country and here locally are interrogating all of what we are doing to make it both as effective as possible in terms of what we know works from all the best science and all the best experts, thinking about ways to both expand what we're doing, make what we're doing more effective, and also to consider new strategies if and when numbers do not begin to level off and obviously decrease. I want to reiterate that this is happening, unfortunately, nationally as well as in San Francisco, and we are speaking certainly with colleagues from around the country to ask some of these really important questions to be able to turn the epidemic around.
thank you.
Pardon me if you covered this at the very beginning, but is this based off of another, I mean, this is happening nationally, another Department of Health that is doing something similar? And then also, will we find out, when it comes to overdoses, will there be an overlay of residency status, whether they're from San Francisco or elsewhere? I think that's part of the conversation that we're having.
I think I might have missed your first question. Your second question is, I think really highlighting how central it is to use data to shape our response. There are a number of questions that we and the public will want to ask about these data, including, as you point out, residency status. There are other questions that we very much want as a health department to begin to look together at data to inform, as the prior question alluded, to be able to shift response, expand response, change response as needed. And part of that is to be able to see evidence and look at data together.
Just whether or not this is based off of maybe another Department of Health's platform elsewhere in the country?
I think we are taking a multi-pronged approach to responding to the overdose epidemic. We are aiming to use, of course, best evidence and science and experience that both others and we ourselves in San Francisco have had. This is a city that has had a long history of using innovative approaches to working with people at risk of overdose, people who use drugs, people with addictions, including pioneering work in street-based, low barrier ways of using medication like buprenorphine, ways of doing outreach into communities, ways of setting up services that are low barrier to increase access. Like other jurisdictions, or unlike other jurisdictions, San Francisco had relatively low and stable rates of overdose until really quite recently, and until while the rest of the country, or much of the rest of the country, was seeing steep increases in overdoses. And we attribute that to some of the really important work that has been happening here in this city for many, many years by community providers and by DPH. Fentanyl is a game changer for us as well as other jurisdictions, and is really asking all of us to take steps that were perhaps in the past unnecessary. We want the general public, people who might know people at risk of overdose, to help us communicate messages of hope and recovery, that treatment exists, it works, and recovery is possible.
Standard.
Is there a concern that more publicly available numbers about just overdoses and the fentanyl crisis will drive more negativity and more stigma around recovery for these things?
No. I think our position, as you heard from Dr. Colfax, is that making the numbers transparent enables us to be working off together the same information, encouraging conversation about both what is happening in our city and what are the possible steps we can take to change that reality.
I have a question. You talked a lot about medication-assisted treatment. Do you have a rough breakdown of how many people entering treatment programs are getting medication versus how many, is there an option to not use medication as part of the treatment program?
And when you, to respond, the question was about what proportion of people entering any kind of treatment programs are receiving medication. Let me first address the second part of your question. The receipt of medication is voluntary. We want to, as best practices, as physicians, as clinicians, we want to work with clients or patients to offer all options, make recommendations where we have good evidence that one route might be more effective than another. But ultimately, it is a patient or person's preference as to what kind of treatment they would like to receive. And we want to treat all treatment to be voluntary, and it's very important to sort of hold that out, that while we know from the science medications like methadone and buprenorphine are the most effective, there are people who enter treatment without and achieve recovery, importantly. In terms of breakdown of overall who is receiving medication and not in different kinds of treatment, I don't have that answer at hand. I think, though, I do want to just comment on many of our treatment and data systems, because of federal confidentiality rules and the ways in which data is sometimes must be anonymized, we are not always able to match data across treatment programs, and that is can be a limitation in answering your question, both locally and nationally, but it is an excellent question.
Okay, one more? Good? Thank you.
Just last month, you said how many people were in the programs for behavioral health and substance abuse. What is that number right now in the city of San Francisco?
So we did not, we gave you overall estimate of numbers, which I need to go back and check. What we're providing today is specific, and you will see later today, estimates by treatment type. So this year, 2023, we know that 470 people entered residential substance use treatment from January to June. Last year, the most recent data we have, approximately 2,500 people received buprenorphine treatment in San Francisco. I should caveat that number is both publicly funded and private clinicians using state data, and approximately 2,200 people were treated with methadone that's in 2022.
Thank you, Loretta.
Thank you. Are you guys gonna cut out any